You used to be active, walking, exercising, praying with ease. But now these very same activities have become a real struggle. Have you noticed strange aches and pains, especially in your knees, hips, or hands, now that you're in your 40s or 50s? So do your joints hurt often? Maybe all the time? Many women assume this is just part of getting older. But what if I told you that there's more to the story and that you're not alone? In fact, nearly 40% of women in perimenopause and menopause experience joint pain. It's something that you don't talk about, but it can have a very deep impact on your physical health, emotional well-being, and even your spiritual connection. So let us understand the causes and reasons for these joint pains. Do watch this video to know how to find relief from it, inshallah. Assalamu alaikum and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revived Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more focus, energy and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our theme. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormonewise, where I talk extensively about menopause and perimenopause and all the different changes that your body goes through during this phase. Let me tell you about Nadia. When Nadia first came to me, she was struggling with severe knee pain. It had become so bad that she was having difficulty going into ruku and sujood. Sometimes she had to pray sitting on a chair. This wasn't just a physical issue for her. It impacted her spiritual connection, leaving her feeling very low and disconnected. Also, she had gained quite a lot of weight after menopause, which only made the joint pain worse. As we worked together, it became clear that this pain wasn't just normal aging, it was her body crying out for support. Many women silently endure joint pain in perimenopause and menopause without realizing it's often connected to hormonal changes. So let's break it down. During perimenopause and menopause, levels of estrogen, progesterone and testosterone start to drop. These hormones don't just affect your mood or your cycle, they also have a protective role in your joints. Without them, your joints become inflamed. Tissues lose elasticity and moisture, causing stiffness and pain. If you've gained weight, which is quite a common symptom of perimenopause and menopause, there's more wear and tear on your joints, especially your knees and your hips. Some sisters also develop food sensitivities during this phase of your life, triggering even more inflammation. Let's not forget certain types of joint conditions that can show up during this phase of your life. First one is osteoarthritis, which is caused by wear and tear, most common in knees, hips and shoulders. So you could have pain, stiffness, swelling, even cracking sounds, and less range of movement. Then there could be rheumatoid arthritis, an autoimmune condition often worsened by hormonal changes of perimenopause and menopause. So you could have a lot of joint tenderness, especially in your hands and feet, morning stiffness, fatigue, and sometimes what feels like just aging is just your immune system or inflammation getting out of balance. So have you experienced this kind of joint pain? Has it affected your ability to stay active or even your ability to pray comfortably? Please do share your experience in the comments and know that you're not alone and your story could help somebody else feel seen. So let's now talk about what you can do, inshallah, to ease joint pain naturally and holistically. First of all is anti-inflammatory foods like turmeric with black pepper, ginger, omega-3 rich foods like chia seeds, walnuts and flax seeds. This can really reduce inflammation. Exercise is great, but gentle movement, which is crucial to lubricate the joints. So try things like swimming, Pilates, stretching. Avoid high impact exercises like running or jumping because they can strain your joints further. Next thing you can do is try and release weight gently. Even a small reduction in weight can ease the pressure on your knees and hips. Stay hydrated. Water helps maintain joint lubrication and reduces stiffness. Hot and cold therapy can work wonders. So you can have hot therapy in the form of a warm bath or a heat pack. It increases the blood flow and eases stiffness. Then you can follow it up with a cold pack, which reduces inflammation and numbs pain. So alternate between the hot and cold to see what gives you the most relief. Supplements that you can think of taking is things like omega-3, vitamin D, calcium as well. But before you take any kind of supplements, do check with your healthcare provider, especially if you have underlying health conditions. Now, if you're having a lot of pain, HRT or hormone replacement therapy can help reduce joint pain by balancing out the hormone levels. If you need to, you can take some pain relievers in the short term, especially during flare-ups, but always use any kind of painkillers mindfully. As a believing Muslimah, I know how hard it is when physical pain interferes with acts of worship. But remember, Allah sees your struggle. Every sajda made in pain, every moment of patience is written for you as a reward, inshallah. When your joints ache, make dua for healing. Recite the adhkar for pain. And if you need to sit while praying, know that Allah subhanahu wa ta'ala is aware of your struggles. Have you experienced joint pain and perimenopause? And what helped you find relief? Let me know in the comments. I read every one of your comments, and your insights might help another sister feel supported. If you are getting joint pains, it's possible that you may be having other symptoms of perimenopause like weight gain, period problems, acne, bloating. And if that is so, I have something for you. But before that, share your thoughts in the comments and don't forget to like, share and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic and Islamic perspective. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help ease them. Do check them out. Jazakumullahu khairan for watching, and inshallah, I will see you in the next video. And remember, your best is yet to come.